Hi, welcome to Healthy for Life. I'm Dr. Scott McCann, the Director of Health Education with the Santa Barbara County Public Health Department, and this is my charming co-host, Rose Davis.
I like charming.
Good.
One of these days you're just going to belt out, "This is my awesomely wonderful co-host." That's the day I'm waiting for, okay,
Next
Scott?
month.
All right, thank you. I appreciate it. Well, welcome to Healthy for Life. Healthy for Life is about promoting healthy behaviors and preventing health problems.
And this is the second in our two-part series on diabetes. We talked about types of diabetes, causes, symptoms, and so on in the first show. And today we're really going to focus on prevention and treatment of diabetes. Very important subject. I think you'd shared this is epidemic level problem in our culture. Locally, lots of people.
You gave us some great stats. It was the 9th leading cause of death, diabetes was, in Santa Barbara County in 2007. And almost 6%, which is 20,000 people that year, were diagnosed with diabetes. So
and probably a lot more out there who weren't diagnosed, unfortunately.
Right, yeah, that's probably true.
So we have our expert back, Dr. Andrea Ruth from the Diabetes Resource Center. Thank you for joining us again.
Thank you. We're so happy you could come back.
And if you could do a quick review maybe of last time?
Sure. So in the last show, we talked about the types of diabetes. Type 1 diabetes, in which the body does not produce enough insulin. Type 2 diabetes, in which the body makes insulin but isn't able to respond normally to it. And gestational diabetes that happens during pregnancy.
Right.
Okay, so in terms of the causes are complicated. Type 1 diabetes, as I said, is caused by the body not producing enough insulin. And the tendency toward this is inherited, but then the disease itself is triggered, we believe, by some infection or some other trigger, or may be triggered, okay? Type 2 diabetes is a combination of genetic and environmental factors, and obesity is the major cause of type 2 diabetes in addition to family history. And obesity places you at risk for type 2 diabetes because you develop what we call insulin resistance, where the body is not able to respond normally to the insulin that you produce, and you have high blood sugar levels.
Right.
Finally, gestational diabetes results from the complicated hormonal interactions during pregnancy, and it's also increased in women who have a increased family history of diabetes or who are overweight at the start of the pregnancy. Okay, the symptoms of diabetes, they're variable. We talked about the fact that people with pre-diabetes may have no symptoms. But once someone has diabetes, they may feel a broad range of symptoms. They may be tired, they may have increased thirst and increased appetite, they may have weight loss, blurry vision, they might have numbness or tingling, pain in their arms or legs. They may have increased infections, wounds that won't heal, or even sexual dysfunction. Finally, the health impacts of diabetes can affect almost every part of your body. Diabetes can increase your risk of heart attack and stroke. It can affect your kidneys, your eyes, your circulation, and untreated, it can lead to kidney failure, blindness, or amputation.
That's why your whole body.
Your whole body.
It really does.
But that's why recognition and treatment are important, and why prevention is so important for us to speak about.
Right.
Wow. I don't think people realize how serious it can be. So focusing a little bit on the treatment and prevention, let's talk about treatment first. When somebody finds out they're either pre-diabetic or diabetic, what is sort of the key tasks that they're facing at that point?
Okay. So Scott, we talk about working with your physician to develop a care plan. And the care plans might include a meal plan, a physical activity plan, a plan for checking your blood sugar, goals for your blood sugar, and then determining if and when you should take medication and when you should have regular checkups. And I believe we have a slide related to these. Okay. So when we speak about the things that your doctor will monitor, I'll give you a few technical terms. We talk about the ABCs. The first one is your A1C, the second one is your blood pressure, and the third one is your cholesterol. So the A1C is a measurement of the hemoglobin in your blood that's bound to glucose. And it's reported as a percentage, and it usually gives you a measurement of what your long-term blood sugar control is. So we look for a number of 7%, or I should say under 7%. And many providers will work with their patients to have that number be even lower. But if it is abnormal, it can be treated by lifestyle changes, dietary changes, physical activity changes, or medication. The other things, the blood pressure, the cholesterol, that's because of the risk of heart disease that goes with diabetes. So you want to modify those other risk factors. Finally, a few more tests that diabetics will generally have: an eye exam, a special foot exam, and a special urine exam for something called microalbumin, and that looks at your risk of kidney disease. Okay, so checking your blood sugar is very important to see that your diabetes is under control, and it tells you if the insulin is at an appropriate level and if your medication is working and how all of these aspects of your care plan are working together. Now, generally, when you check your blood sugar, people will use a lancet, which is a tiny, sharp device that will give you a drop of blood.
Right.
That drop of blood is placed on a strip, and the strip is placed into a glucometer, a glucose meter, which is a little computerized machine that can give you a measurement of the blood sugar. It's very.
So they do this at home?
They do it at home, and it's amazing the technology that they have now related to diabetes. People who have diabetes will check their blood sugar many times during the day.
Oh, really?
When
They have to poke themselves each time?
Each time.
I guess you just get tough.
You get tough. So the typical times when you may check it would be when you wake up in the morning, before your meals, 1 to 2 hours after your meals, and then around physical activity, both before and after physical activity. We want to talk a little bit about how people may feel if their blood sugar is either too high or too low. So we have a few more slides for these as well. If your blood sugar is too high, you may feel thirsty or hungry. You may need to urinate more often. You may feel like your mouth and skin are dry, have blurry vision, or feel sleepy. And in the long term, people may be more likely to have infections that don't, or injuries that don't heal as readily. Now, if the blood sugar is too low, you may feel weak or tired. You may feel hungry, nervous, upset, dizzy or shaky, or like your heart is beating too fast, or your vision may be blurry. And there are a lot of things that can be related to a low blood sugar, either not having the right balance of diet and insulin, sometimes being more active, sometimes the stress of an illness will cause someone's blood sugar to be either too high or too low. You may have seen people who have diabetes whose blood sugar is low, or and generally the most rapid thing that they'll do is eat something that has a good, quick source of sugar in it.
Yes. Which is kind of, I don't know, it almost seemed contrary to me in the beginning that why would you eat a Reese's peanut butter cup all of a sudden?
Right, because they're spending the rest of their day monitoring carefully the amounts of sugar that they're taking. But because the symptoms of low blood sugar are so dramatic, you generally want to, that person wants to eat something that will get that blood sugar up right away. Okay, so that's the checking of the blood sugar. The next thing is being physically active, because the exercise that we have each day does affect our insulin production, our usage of insulin, and our blood sugar levels. So it's best to set a goal, something that you can accomplish, and stick to it. And it may be small at first, right?
Right. Yeah, we have to start small. At least you're starting, right?
That's right. But the health benefits are huge.
A friend of mine was saying they started just by walking around the block, and then a week later they started walking around twice, and then now they're up to over a mile a day, and doing it gradually makes it easier, I think, to do.
You start liking it and almost becoming hooked on it, where you need to go on your walk because you know it's going to give you that boost of energy and that feeling of well-being. So it's really just getting started, and then pretty much you'd stay on it.
That's right.
Yeah.
Absolutely. Absolutely. And I think the health benefits in terms of not just the physical benefits, but the mental benefits of exercising are huge.
Yeah, that is so true, isn't it?
Okay, so just quickly about exercise, people who have diabetes do need to be concerned about their blood sugar while they're exercising, because there can be fluctuations. That blood sugar can become too low after exercise or too high, generally too low. So it's important that they check their blood sugar both before and after vigorous exercise.
Okay.
I have a practical question.
Yes.
If you're poking yourself frequently throughout the day, do you run out of places to do it, or is there a system for rotating where you do it, or just
You know,
curious?
every person chooses a system that they're comfortable with, but
Okay.
they'll just rotate, choose different places,
Okay.
you know, different fingers. And, you know, I think many people who are not diabetic are frightened about that idea of checking blood sugar. But I think for people who have diabetes, it's just second nature. And if you ask them, does it hurt? You know, many of them will say not really. It's just a part of their life. And then, and that blood sugar measurement is such a tool to help them stay healthy. But it's a good question.
Okay, thanks.
Okay, lastly, any discussion of diabetes wouldn't be complete without talking about diet. And managing your diet is very important. You'll work with your care provider, your physician, or the nutritionist that you're working with to set up a meal plan that includes the amount of carbohydrates that you're eating and how that diet is related to the amount of medication that you're taking, if you are taking medication. Okay, and then health maintenance. People with diabetes should have regular checkups, and especially in the fall, they should make sure they get a flu shot.
Just so your overall health is
Overall
is
health,
good. Okay.
yes.
Okay, good point. Well, a friend of mine was diagnosed with prediabetes recently, a man about my age in his mid-50s, and he took it very seriously and did, I think, what physicians and health educators like to see. He changed his lifestyle quickly. He cut out all the extra sugars and snacking that he had done. Not only did he get his blood sugar down to a non-diabetic level, but he lost about 20 pounds. He said he feels better.
right.
He looks great. And so I interviewed him about that. And this is a guy I go surfing with. We've been friends for a long time. His name's Mark. So let's see what he said.
Excellent. Great.
So Mark, tell me about your experience with prediabetes.
Yeah, thanks, Scott. I do an annual physical around my birthday every year, and last year I went in and did my physical, and I always have some blood work done during that physical, and the report came back that I had a pre-diabetes condition. And so the doctor said there was a couple options that I had. I could look at medication, or I could try to change my lifestyle, and I opted to do that. And so that entailed eating a little differently, especially cutting out sweets. And then he wanted me to lose 5% of my body weight. And so I basically just cut out my sweets. I don't eat cookies or cakes or anything like that anymore. Didn't change my regular meals too much. And doing that made it easy to lose weight, so I lost about 15 pounds. And when I went back for a follow-up, I actually came into normal levels. In addition to that, I exercise, and I've always been pretty good about exercising, so I didn't increase that too much, but I do exercise a little bit each day, and on the weekends especially, I enjoy surfing and golfing. So those changes really helped that condition.
And was it the diagnosis that motivated you to make those changes?
Yes, that helped motivate, but I also anytime you feel like you can lose weight and feel a little better, that's always a good motivator in itself. But definitely faced with, do I want to go into medications and go into maybe diabetes later on? It is not a good path to go down. So if I had any opportunity to change that through changing my lifestyle, to me that was the better option, and that's what I chose, and I've been successful.
Great. And have you felt any differently since losing the weight?
Honestly, I didn't feel bad. I do that physical normally every year, so there wasn't something that triggered me going in. It's just something in my routine annually. But obviously, I enjoy being a little lighter. My sports activities are a little easier, and I feel like my appearance is better.
And I noticed you popping up pretty fast surfing there on your board when you're dropping in. So that's got to be a little bit weight related there.
The longer I can ride a shortboard, the better.
All right. Well, thanks a lot.
Thank you.
Wow, that's great. Good for Mark. Can he out-shred you now?
Oh, he's
when you're,
shredding like crazy.
When you're surfing?
Yeah.
Yeah, good for him. And I mean, it's remarkable, and it's great when you can prevent diabetes just through prevention. But at some point, if you do have diabetes, you're on medication, right? And what's the story with all of the medications that they need, and what is that like?
Okay, so people with type 1 diabetes will need to take insulin. And talk about that at the end. Type 2 diabetes, the one that's the most common, changes over time as the pancreas makes less insulin. So initially, people will manage their type 2 diabetes with diet and exercise. But if they find that that combination is not enough to control their blood sugar, their doctor may prescribe medication. And there are several different kinds of medication, but the most common one that most people will begin with is called metformin. And metformin stabilizes your blood sugar 2 ways. It decreases the amount of glucose that your body produces in your liver. It's actually kind of counterintuitive that you're making glucose while you're having a problem with glucose. But it also improves the ability of those fat cells to take up the glucose. So that insulin resistance we learned about in the last show, it improves that insulin resistance. It also decreases the fatty acids in your blood. So it has a lot of health benefits. And people who are taking metformin for their diabetes will generally find that it often helps them to stabilize their weight as they're stabilizing their glucose and their insulin. So it's an added benefit. It's not a reason alone to take the medication, but it helps to improve their overall health. Right. For people who take insulin, that's given by subcutaneous injections, meaning just under the skin. And there are many different types of insulin that people take, but there's generally a combination. There's one called a basal insulin, which is your baseline insulin, and that is given either by injections once or twice a day, or you might know people that use the insulin pump. And that's a basal amount of insulin that's given throughout the day. And then before each meal, they'll need an added amount of insulin to help them handle the glucose that's going into their body.
Okay.
So that's the way the medication. And your physician would discuss each of these options with you.
Right, but I guess, the goal, if you don't have it, is to not get it. So maybe you could just review again, how can we prevent getting it in the first place?
Right, absolutely. So the good news and the news we want everybody to remember is that type 2 diabetes can be prevented by lifestyle changes. And there have been studies that have been done on people who had pre-diabetes, such as your friend Mark, and it's shown that if they decrease their body weight by as little as 5 to 7%, so a 200-pound person losing 10 pounds, for example.
Oh, wow.
And if they exercise 5 times a week, pardon me.
I like that 5 times a day thing. Half of our audience just fell off of the couch.
Yeah, just 5 times a day, pardon me.
You could do it.
That those people could prevent the development of diabetes. So that's the good news and the message that people should remember.
Right.
Great.
So eating a healthy, balanced diet with lots of fruits and vegetables and little fat and sugar is your best way to prevent diabetes. And this will help keep your blood sugar to a healthy level and help you to keep your weight down. And getting regular exercise, the recommendations are at least an hour a day of walking, biking, swimming, anything that gets you moving will also help keep your weight down and help prevent diabetes. And it's best if people schedule physical activity into their life that fits in with their lifestyle, something they might be doing anyway or something that they enjoy doing.
Doing it with a friend helps me be motivated. My wife or a friend, we go surfing, we walk, something, versus doing it alone. But you're right about scheduling it in when it fits for you.
I like running with my husband. Because when I run alone, sometimes I stop.
That's right. We're more accountable.
Well, we were talking about dogs earlier. They get you up and moving.
The dog definitely keeps us moving. But, I have control over the dog.
That's
if
true.
I stop, he just stops.
Yeah.
But, with my husband there, it's a little more intimidating. I feel like a slug when I stop.
Well, I've started getting up while I'm watching TV and just stretching and moving around a little bit, partly because my back gets sore if I sit too long. But
How
I
much
realize
TV are you watching?
About 50 hours a day, which is unusual. So I think we were talking about meetings. You could stand up at work and get up and move around.
A stand-up meeting.
Yeah, exactly.
Yes, it should be the new norm.
Get up and move. Well, I have to talk. My dad just turned 85, and I went down and visited him and talked to him about it. His father had diabetes and wasn't overweight, so he had some family disposition toward it. And so I asked him about he used to ride his bike to work, swim. Now that he's older and doesn't travel as much, he uses a treadmill. So I asked him a little bit about his working it into his routine and the benefits of it. So let's take a look at that video.
Oh, great.
So, Dad, how often do you use the treadmill?
I walk about five or 6 days a week, between 45 minutes and an hour. I'll be 85 in about 2 weeks. Well, I like to get out and see what's going on in the neighborhood. I can watch who's walking by, and I listen to the radio usually. I have the radio on NPR for an hour. I've been doing this for about 6 or 7 years. I usually do it from about 8:30 to 9:30.
And why do you do this?
I think it's good for both my physical and mental health. I try to keep my joints loosened up. Heart rate is good. I have a little more flexibility and feel like I'm wider awake.
And what keeps you going when you maybe don't feel like doing it?
Oh, just motivation. Have self-motivation. Say, well, do it whether you want to or not. This is good for you.
Do you have any advice for other people who are thinking about doing something like this?
Oh, I think they should absolutely do it. It's good for them, and they need the physical exercise, certainly. Keep themselves in shape.
He's awesome.
Yeah.
You look
yeah.
like him.
We could all do that. Yeah. Yeah.
Well, that's great. I'm motivated because of that. Now, Andrew, I know you said it went through the resources last time, but just in case some of our audience didn't see that show, could you just tell us quickly again, maybe the resources that you're with and the others that you know about?
Sure. So, and there's a picture up on the screen, the Diabetes Resource Center of Santa Barbara County, the Sansom Diabetes Research Institute, or of course the Public Health Department are all wonderful resources for people who want more information or resources to help them with their diabetes.
Good.
Right.
And we've got one more of our cooking segments, our healthy cooking
know.
segments. I think it was tacos this
Chicken
time.
tacos, lean chicken tacos.
Healthy chicken tacos. Yeah. So
Yeah,
let's take a look at that.
Welcome. We're going to have another segment of Cooking for Life with our galloping gourmet, Scott McCann.
And Rose Davis.
That's right. And you're going to show us how to make, first of all, fish tacos out of our great
This wonderful cookbook, Everyday Healthy Meals from the Network for Healthy California State program. You can get this for free online. Just Google Everyday Healthy Meals or the Network for Healthy California or Champions for Change. It's all part of the state's obesity prevention program, Making Healthy Meals. And we will send you one if you don't have access to it online. You can call me at my office, 681-5270, or email me, scott.mccann, sbcphd.org. And we'll get you your own copy. We have it in Spanish and English. Wonderful cookbook, healthy, easy to prepare, and low-cost meals that you can't beat. So we are doing actually fish tacos in here, but since we're not huge fish eaters, we're going to go with the chicken instead. But otherwise, same recipe, works either way.
We don't know how to fish. That's the reality.
That's
but we
it.
do know how to shop.
So what have you got here, Rose?
Okay, so I chopped up some cabbage. Fish tacos always have cabbage, and even when you're substituting fish for chicken, the cabbage is still good. Great fiber, gives it a nice crunch. Have some chopped up tomatoes, and then our chopped up fish, aka chicken, which we're going to put in, and some fat-free sour cream.
Fat-free sour cream. Again, one of the benefits of all these recipes is the low fat, low oil, low butter. So we're using fat-free sour cream, a lot healthier than regular sour cream.
Oh, and you're going to handle the
We've
serrano
got a couple
peppers.
of serrano
I'll come over
chilies here because I like a little spice. So I thought the recipe was a little low on spiciness, so we're going to just mince this up, actually as small as I can cut it. Now we've got our little spice to add here with the chilies. We've warmed up some corn tortillas. Corn's generally a little healthier, lower fat, lower calorie than flour tortillas.
That's more flavor too.
And it's got a little more flavor. So Rose, here's yours. We've got those nice and warmed up. So why don't you start?
I know, and I'm looking at the recipe and basically put it all together.
At this point, that's right.
It's my kind of recipe.
Yep.
Okay, so Too bad I don't have one of those little holders so I can
Yeah,
get
we
it
don't
just
have
right,
the
but that's all
holders.
right. So I'm going to, you know what also might be kind of handy for you folks at home, ahead of time, you could even mix your chicken and the sour cream together so that you have just kind of a chunky little paste
That's not a
kind
bad
of thing
idea,
to
yeah.
do there. And I'm going to actually pass on the
okay.
peppers, Scott.
They're not for everyone.
No, a little salsa, maybe a little taco sauce might have be about all
Okay.
I can handle. Mm.
All right, looks good already. I'll do the same. Put on my fake fish here, which is a lot like
I know.
chicken.
And since I love tomatoes so much, I'm actually gonna steal a few more tomatoes. while
Tomatoes
you're not
are one
looking.
of the healthiest foods you can find.
I love them.
Yeah, yeah.
Yeah. So what's up with my son who hates tomatoes? Won't look at a tomato,
You
but
know-
will eat salsa with a spoon.
I was that way probably
get
at
it.
his age, and now I love tomatoes all by themselves. So
Oh, okay, I'm encouraged.
I was the
There's
same with
hope.
avocado. I only ate guacamole, and now I love avocado too. So I am going to put on some of these serranos here.
There you go.
Oh yeah, I may be regretting it, but
Spice of life.
gotta go for it. Okay, so we're going to
All right.
actually eat these babies.
Cheers.
Cheers.
Another
Yeah,
healthy cooking experience here on Healthy for Life.
Great, great. The sour cream sorts of puts out the fire from the chilies. Great. And what did it take us? 5 minutes to do this. What
know.
are the
So
calories?
easy.
These are about 100 calories, I think. No, 200 or so. Low cost, low fat,
Right.
low calorie, easy, quick. Can't beat it.
I love it.
So remember, get the Everyday Healthy Meals cookbook either online
free.
or contact us. We'll send you your own copy, and happy healthy eating.
Happy eating.
Good stuff, huh?
Yeah, they were fun to make.
Yeah.
They were and easy. I love an easy meal.
Easy, low cost,
I'm
and
sure
healthy.
you can
huh?
appreciate that too as a mother. We never have enough time to cook healthy. It's easier to just go to fast food, but don't do it.
Well, you
right?
talked about the bag of salad and some of the things that are making
Right,
it easier
right.
to eat healthy, and that's great. I hope it keeps going that way.
Oh, me
you know.
too.
Well, and the other hint is to let your kids help you with preparing the meal, because then they're more interested
Amen,
in eating
sister.
it if they've helped. with that healthy
Absolutely, and they
food.
know
You're
what's
right.
in it, and yeah, great idea.
You're right.
Okay, great.
Yeah. Well, we really want to thank you for coming. You've added so much, and
Yeah, you
we're
really
lucky
have.
to have you in the community, saving lives, really, with the education
Absolutely.
and work that you do.
Yeah,
So,
it's been great. Thank you.
well,
Thank you very much. I appreciate
yeah,
it.
we're thrilled. And if anybody has questions, because I know we didn't have the resources up there, and there are other ones we didn't mention, call me at the Public Health Department, 681-5270. You can go to our website and access us through email and get other information there.
Right. Lots of good stuff out there. So thanks again, and thanks for watching. See you next time.